This is transabdominal ultrasound, and this is the case of double spleen or polysplenia. Here you can see this is the first spleen, and if you just take the measurement of this spleen and look for the echo texture and the size of the spleen, you will be able to appreciate that this spleen is lying anterior frontal. So this is what the first spleen is, and when you move around here on the back of it, this is the another one spleen, and this is the case of the polysplenia. Here you see this is the posterior part of the spleen. So these are double spleen. These are called as polysplenia. As you already know, there are multiple congenital varieties of the spleen, like varying from asplenia and polysplenia, which in this case you are able to see the polysplenia, and also splenogonadal fusion can also be seen, and wandering spleen. So this is the case of the polysplenia on the ultrasound imaging. Mind you that in the ultrasound scanning, the most important part is the report writing. This is what the report writing is, which display your diagnosis in front of your colleagues, your physicians and surgeons. So you have to write the report in such a way that you can easily pass on your message, that what you are going to say about it. So far this polysplenia is concerned, here you have to write that spleen 2 are in numbers, anterior frontal which is measuring blah blah blah, and posteriorly lying spleen is measuring blah blah. Take the measurement into 3 dimension. Comment on the parenchyma that the parenchyma appear normal. Look for the splenic vein, whether it's dilated or not, or there is any parasplenic varices or not. After this, you must come to the conclusion that this is the case of the polysplenia. Whenever there is polysplenia, mind you, there will be a certain other congenital abnormalities as well, or it may be associated with other congenital abnormalities. For that, you have to have the CT abdomen for the complete survey. So this was the report for the polysplenia.